All right. Well, welcome everybody. So for those of you, if you don't know me, I'm Dr. Deb. I own Serenity Health Care Center. For those of you who've been with us before, welcome back. We host these meetings the third Monday of every month. They're meant to be interactive. We typically will do a little presentation like this. We'll record the presentation, send it out to you guys afterwards. After the presentation is done, we'll open it up for question and answer. You guys can ask whatever you want. We do turn off that recording on that. We've had some people ask us to keep that recording part on, but it's been a little bit of a challenge with HIPAA and things like that. So we typically will turn that part off and not send it off to everybody. I know there's a lot of great nuggets in there. I'm trying to figure out a way that maybe we can transcribe some of it and send it out. So I have my team working on some of that as well. But you can ask questions about whatever you want. If you want to ask questions about the lecture, great. If you want to ask questions about anything else, that's totally fine too. We go until there's no more questions, usually around 8 or 8:30, and then we sign off for the evening and make it an interactive evening. So without further ado, I'll get started. Tonight, our conversation is around mitochondria, where healing and energy and aging begin. And we talk about this because mitochondria is so important to the healing process and to the aging process. We can slow down the aging process if we fix our mitochondria. If our mitochondria are working really well, we can have better health. And so there's a whole host of things that we can do to help support the mitochondria. Some work really well, some don't work really well. We're going to talk a little bit about all of that tonight and why it's important for us to look at the mitochondria as well. So when you've done absolutely everything right and you're still exhausted, we typically then look at the mitochondria. Many of you know we look at other reasons too. We look at adrenal fatigue and infection, and we'll cover some of those things tonight as well. If your sleep is good, your exercise is good, you're eating relatively good, and I say relatively good because if you could be 80 to 90% clean, 80 to 90% of the time, that's really all we can ask for people. To try to be 100% good 100% of the time, it gets a little challenging. Everybody wants that one special treat for their birthday or a wedding or whatever it is. And that's okay. And your body should be able to adjust and adapt to those things. And they should be much more resilient than not ever being able to have anything. So we'll talk about that. But when all of these things are good, your labs are normal, we can't really find anything going on, and you still don't feel right, that's typically, again, where we look at mitochondria. So there's a reason for all of your cells to start to maybe diminish or not be as robust as we would like them to be. And so it's all about finding that answer. And oftentimes, what we're looking for is an infection, a deficiency, a disruption in the hormones, something like that. When we can't find any of those things, then we have to look at the immune system. And I think in many ways, we don't look at the immune system as maybe not as well as we should, but as efficiently as it should. And the immune system is very dynamic. And so looking at that immune system differently is really important as well. And I'll talk a little bit about that later on too. So what if your symptoms aren't random, but they're truly connected? These are also mitochondrial signals, not mysteries. So when we wake up tired, even after 8 hours, when we have brain fog that just won't lift, when we have weight gain despite eating right, when we have mood swings or feeling flat, when we're slow for recovery after exercise, or if you just kind of feel older than your true age, these are all symptoms that are connected and they tell us the picture of what's going on. And when you work with an integrative provider, one of the best things that you can do is to tell your story. Us hearing the story is everything. It's not so much about this lab result and that lab results. It's the story. We want to know, when did your symptoms start? How did they start? Why did they start? What was going on in your life around the time that it started? Even if that means you go all the way back to childhood, that is where the nuggets lie for us to help understand exactly what's going on, what triggered these things, how it started, and how all these things fit together. When we have that chronological order of things, we can see what's going on. What's happening in your symptoms today, they're happening and they're real, but we have to get to the root cause of what started this whole thing, because it's a cascade of events that have happened over time that have gotten you to where you are today with the symptoms. And these are just new symptoms that are occurring because the cell turnover is different now. And your symptoms that when you first started having your exposure to something may look very different because your cell structure was very different back then. And so the more the cell structure kind of breaks down and doesn't turn over the way it's supposed to, the worse the symptoms tend to be and more difficult for them to resolve. So obviously you're not alone. Many people have very similar symptoms. There's a lot of mitochondrial issues these days. And in modern medicine, we tend to dismiss the symptoms. We don't look for the root cause. We dismiss the symptoms. It's anxiety, it's depression, it's diet, it's lifestyle, it's stress, all of those things. In integrative medicine, we're always looking to see if we can find the root cause. Sometimes it's very easy. Sometimes it's very challenging. Sometimes we never really truly identify a root cause. It may be multiple root causes. It may be one root cause that triggered another, that triggered another, that triggered another. And so roughly 45% of adults report persistent fatigue, and most never receive a cellular explanation for what's going on with their fatigue. We look at hormones, we look at thyroid, we look at adrenals, we look at cortisol, we look at diet, and all of those things can give us an idea of what's going on with the fatigue level. But if the mitochondria are damaged or they're stressed, we know that the fatigue can come from that. So then you have to figure out what caused the mitochondrial to be an issue in the first place. A really great example of this is autism. We know that kids with autism have a mitochondrial deficit. There's something going on in their genes that don't allow their cell turnover to happen the way it's supposed to. There's something in their environment that does that. As we get older, if we have brain fog and memory issues and things like that, that's a mitochondrial issue. And our mitochondrial age just like we age. And so when that mitochondria is optimized, the symptoms are usually better. But unfortunately, oftentimes we will see that the symptoms don't completely resolve either. And even though the mitochondria we can see on paper looks great, the person may still have some of the symptoms. And that's what makes it challenging, because if we can see the mitochondria are good, but the symptoms are still there, we have to go back and look again for what are we missing. So 1 in 3 women over 40 report significant energy decline, and 76% of the chronic illness patients show a mitochondrial dysfunction. Now, we can test mitochondria. We call it a prodrome scan, and it allows us to see what's happening with your plasmalogens, what's happening with the cholesterol, what's happening with kidney function, and then what's happening with the actual mitochondria. And is the mitochondria deficient? And if it is deficient, we can track that over time. The other thing that helps to give us a little bit better idea of how the mitochondria are functioning is something called telomerase or telomeres. We can do that type of testing, and we can see what's going on with the mitochondria. And there's more and more new age tests that are coming out that are showing us our biological age versus our chronological age, which in ultimate reality tells us what the mitochondria is doing and where is the mitochondria at. And so all of those things are glimpses and windows into what the mitochondria is doing. And then we can use those things to track what we're doing to you to see if we're improving it, leaving it the same, or even ultimately sometimes can we make it worse? And that can happen from time to time. So let's meet what your mitochondria is. Who is your mitochondria? What are they? Mitochondria is a big word for cell structure. It's the powerhouse of the cell. So it's what regulates cellular repair, programs cell death, so that apoptosis that you hear a lot of people talk about. It helps control inflammation, signaling pathways. It produces hormones and neurotransmitters. It manages your stress response cascade, and it helps determine the speed of our age. That's the telomere length that we're testing for. And that telomere length is really important because if you're, say, 40 years old, but your cells are looking and acting like they're 60 years old, that's not a great thing, right? But if you're 60 and they're acting like 40, that's a wonderful thing, because that means your biological age is different than your cellular age. And we want the cellular age to be at a lower age range, quote unquote, than what we are chronologically. So there are 2,000 plus mitochondria in a heart muscle cell. So this makes up 37% of your heart's volume. And the organs that work the hardest have the most mitochondria. And so we can see by how many mitochondria that are there when we're trying to repair something, in the way we're looking at medicine compared to the way conventional medicine is looking at it is very different. It's not the one pill size fits all thing. It's not I'm going to take this drug and I'm going to be better in a week. This mitochondria has to repair, and it takes time to do that. And oftentimes it takes more than one thing. And when we're repairing the mitochondria, there isn't necessarily a prescription medication that we can give you that repairs the mitochondria, but there are supplements that we can give you to help repair the mitochondria and do what we want to do with that. So let's talk now about ATP. What is ATP? Well, this is your body's energy currency. Think of the ATP like cash, and your body cannot run on credit. It needs ready fuel right now for every cell. And ATP is that fuel that fuels the cell that gives your body the energy to do what it needs to do. And without enough ATP, your brain gets foggy, your muscles weaken, your hormones fall out of balance, and everything kind of slows down and becomes very sluggish. So it's important for us to have good ATP structure. It's the body's weight, and we need ATP every single day in the body. So let's look at, how does your body actually make energy? Well, food enters into our body. Everything we take in, whether it's a protein, fat, or a carbohydrate, has to be converted to glucose for the body to use, for the brains to use. And these things get broken down into usable carbon molecules. And then we move into the Krebs cycle. So if you've ever studied biology or chemistry, you remember the Krebs cycle, and we all wanted to forget the Krebs cycle right after we took the test to learn it, because it's a very complex thing. And even as doctors, we don't want the Krebs cycle to be in our brains. When you go back into functional medicine, you realize the Krebs cycle is really important, and we need to understand that Krebs cycle. And carbon molecules are processed in the mitochondrial matrix, and it releases electrons, and it is responsible for what's called electron transport. And electrons move along the inner membrane of the cell. This is what pumps our protons and gives us what's called molecular turbines. So think of turbines like a wind turbine. They generate energy. They give us what we need. That's what helps create the ATP, the fuel source for that proton flow. So it spins the ATP. So it spins the turbine, the wind turbine, and your cellular power generator actually starts to stamp out and brings fuel to the energy. This is how we create energy. So this entire process has to happen from food. So if you're not eating enough calories, or you're not taking in good quality food, you can see where this process can get disrupted along the way, and it can cause issues with the ultimate end result, which is your energy. So we know that people that are in starvation mode don't have good energy, brain doesn't work as well. And again, you can see where this process can get disrupted to disrupt the energy and disrupt the cognitive function as a result of that. Same thing if we're putting in bad fuel, bad food, it disrupts this whole process. So food is really important for us. And I'm sure many of you have heard people talk about oxidative stress or oxidative damage. This is really our hidden saboteur. So this is when the mitochondria make energy that naturally produce free radicals. And those free radicals are known as reactive oxygen species. And in healthy amounts, this is normal, but in excess amounts, they damage the mitochondria DNA, they destroy cell membranes, they trigger chronic inflammation, and they accelerate that cellular aging. They accelerate that telomere length so that our chronological age is older. Our biological age is older than our chronological age. And so when there is more free radicals, there's more inflammation. When there's more inflammation, there's more damage, there's more aging. Many people will say the root of every disease is inflammation. And if that is the case, then us quieting that inflammation can help reverse that. And so we do that by using what's called antioxidants, and antioxidants actually repair, they protect, and they heal. And when there's free radicals, they overwhelm the antioxidant defenses, and the mitochondria actually are what takes the first hit. And so that's where we will see the mitochondria start to decline. And the lower the mitochondria is in our testing, the higher the free radicals are, and typically the more inflammation there is and the more damage that's occurring. So let's talk about stress versus adaptation. When the challenge becomes an injury for you, there is healthy stress and there is unhealthy stress. There's healthy stress when you get a little stressful event and it goes away. For instance, back in the day when we were cave people and we had to fight a lion or a tiger, we had a healthy surge of stress that kept us alive. When that insult or that injury or that fire that was there is gone. We retreated back to the cave and we rested and we repaired our bodies. Today, we are in constant fight or flight, constant stress. If you think about the number of times throughout the day, your body is in stress from work, from talking to someone, from paying a bill, from dealing with a family member that's ill. Anything that causes that physical stress is creating a health challenge for us. Now, the body can't tell the difference between healthy stress and unhealthy stress, good stress or bad stress. So I could be planning a wedding, planning a funeral. The body recognizes the stress exactly the same. So it's the number of times stress goes up and down, up and down, up and down. So those brief, intense exercises that we do when we're at the gym, that's actually healthy stress. The cold exposure, cryotherapy, when you're jumping in the hot shower and at the end, you're finishing it with a minute or two of cold, it's healthy stress. The body's getting shocked a little bit, it's going away. Intermittent fasting, considered healthy stress. Sauna therapy, actually considered healthy stress. This creates stronger, more efficient mitochondria. It's not good, which creates more mitochondrial injury, is the chronic psychological stress I was just talking about, our environmental toxins, the metals, the molds, the chemicals, the infections that our body is fighting, Lyme, the Epstein-Barr, the long-haul COVID, our poor sleep, our ultra-processed diet. This all results in dysfunction, fatigue, and disease. So when the body is laden with all of these things that we're trying to repair from, that's actually creating more mitochondrial injury. Once these things are gone, and even if the only thing we're left dealing with is psychological stress, our bodies can adapt fairly well to that. But when we're adapting and dealing with all this overload, that significantly creates an issue for us. So there are three key patterns of mitochondrial injury. The first one is a deficiency, substrate deficiency. It's where the mitochondria lacks the essential raw materials. So supplements like this are really important. CoQ10, extremely important for the mitochondria. B vitamins, magnesium, L-carnitine, NAD, they're starving for fuel. And so giving the body, the mitochondria starving for fuel, when we give them these nutrients in these supplements, the mitochondria can properly repair. When we're starving, it's fatigue, brain fog, and slow metabolism. As we give these nutrients to the body, the membranes can actually heal and the fatigue and the brain fog and the slow metabolism go away. So there's also then something called membrane damage. And this is where the inner part of the mitochondrial membrane, where the ATP is built, is damaged by toxins. So heavy metals, chemicals, infections, molds, things like that. And it creates the oxidative damage and the inflammation. And think about it like a crack in the engine block. It may not be a wide crack like the Grand Canyon. It may be just a small linear crack that you can see, but it hasn't broken the block of the engine yet. But this is where, if we don't fix this, it's going to get a bigger and bigger crack. And so when we have actual membrane damage, this is where we start to see poor recovery, hormone dysfunction, and neurological symptoms. And I'll move this cursor thing so you guys can see this as well. And then when we get to mitophagy failure, this is when mitophagy is the body's quality control system, and it removes the old damaged mitochondria. If this fails, then dysfunctional mitochondria accumulate. And this is where we see more worsening disease. We might see dementia, Alzheimer's, Parkinson's, MS, chronic cognitive decline, accelerated aging, chronic illness that doesn't repair. This is where we really start to see people with problematic conditions, and we may or may not be able to return them back to their normal state when the body has gotten to this point. So I'm going to try to bring this back down here again so we can see some more. Okay, so we have to look at what's wounding the mitochondria in the first place. And there's 6 categories commonly seen in clinical practice for us. Environmental toxins is by far one of the biggest things that we need to worry about. Heavy metals like mercury and lead, and people will always say, well, where would I get lead from? As long as you breathe air, you're getting lead. If you have osteoporosis, you most likely have a lead level that's higher than it should be in the body, because lead takes up space in the bone. It replaces the calcium in the bone, and lead is taking up that space there. There's mold and mycotoxins, which we all know are everywhere. The pesticides, the herbicides, the glyphosates, the plastics, the microplastics, which are everywhere. Wisconsin is actually one of the number one states for contaminated water. If you have a private well, you have to be very careful depending on where you live in the state. There are some parts of the state where they've tested, and there's over 45% of the wells have been contaminated with runoff from the farm fields with pesticides, biosolids, glyphosates, all of these things that not only disrupt the mitochondria, but increase a person's risk for cancer. So we know that they are there, that we know they're problematic. There's testing that you can do if you have a well on your water. And there's also testing we can do on your body to see if these things are storing in your body fat and creating issues for you. And if they are, we want to get those out. Chronic infections are well known for damaging the mitochondria. Lyme, co-infections, Epstein-Barr, long-haul COVID, parasites, gut dysbiosis, multiple other viruses. All of these things cause the mitochondria to shift. And then, of course, we have the nutrient depletion. We talked a little bit about this a couple slides ago. The CoQ10, the magnesium, B vitamins, and NAD. I would say out of all of these, magnesium is your biggest one. We know that the majority of the people, we can safely say 85 to 90% of the population is magnesium deficient. If we look at all of the people who've been diagnosed with hypertension or high blood pressure, magnesium, they all have magnesium deficiency. And us doing a traditional magnesium test isn't always as accurate because we want to do cellular magnesium testing, and that gives us a little bit better idea of how low the magnesium actually is. There are lifestyle stressors as well, chronic psychological stress, physiological stress. So depression, anxiety, people who are dealing with, financial issues, business issues, employment issues, family stressors, all of those things play a role. And unfortunately, everybody is touched by something like that these days. We have poor sleep quality, sedentary lifestyles. Most of us work at a job where we sit for a good portion of the day. Our bodies are not up and moving the way they should be. That also creates a lifestyle stressor. The ultra-processed foods, I cannot stress that enough. That is one of our biggest downfalls of the changes that have happened over the last 50 years. The chemicals in the food, I don't even know that we can call it food anymore. It's really not food. But that is a big part of it as well. And then, of course, we have medications that also add to mitochondrial deficiencies. We know statins, for a fact, deplete CoQ10. CoQ10 is the number one thing that we need to protect the heart. And there are very few doctors that will tell people if they're on a statin, they need to take CoQ10. It's starting to become a little bit more known. But I still see many people who come in from different practices on statins and nobody ever told them to start CoQ10. And it's very sad. They've been on it for decades without CoQ10 supplementation. We know that antibiotics disrupt the mitochondria. And so it's a double-edged sword. Do we do antibiotics to treat the Lyme infection and the gut infections, or do we let the mitochondria be deficient because of the infections and not treat them with an antibiotic, especially if there's neurological conditions in place? So it's a double-edged sword. Metformin is what's used for type 2 diabetes. It's an oral hypoglycemic agent, has some benefits on the cancer side. It's very helpful for cancer, reducing the sugar so it doesn't feed the cancer. There are some studies from many years ago that show that it might even inhibit the growth of cancer, but yet at the same token, it can also deplete the mitochondria. So we have to pick and choose some of these things that we do. Is it better for one thing, not good for another? So do we give the drug anyway and support the mitochondria, or we try not to give the drug and let the mitochondria heal? It depends on where you're at. And then we have PPIs. So this is your omeprazole, your Prilosec, things like that. When they're taken long-term to help with acid reflux, they deplete your minerals. And so the absorption of the gut gets reduced. There's not as much stomach acid. That's why and how they work. But they also don't allow you to break down your foods properly to absorb the minerals and the nutrients. So although they're helpful on one side, they can be problematic on another. And oftentimes, if that's the case, we will give a PPI and then we will give something like betaine HCl, which is a hydrochloric acid, along with it so that you can still break down your foods, but not have the problems of the gastritis or the acid reflux. In some cases, we can just give the betaine HCl to repair the gut lining. and give you enough stomach acid in there from the product we're giving you to suppress your own stomach acid so that you don't have the symptoms. And it really depends on the person. It can be mixed results there. And then we have light and EMF. We are surrounded with EMF. EMF exposure is electromagnetic fields. So our TVs, our cell phones, the cell phone towers, the Wi-Fi's, all of that exhibits EMF. And that EMF exposure disrupts the mitochondria. If you've seen some of the studies they've done with the trees that are next to the huge cell towers, you can see that many of those trees have died off, and it's because of the EMF that is emitted from those cell towers. For people who live near these big towers, this same thing is happening to our cells, just slowly, and you don't always notice it, but you will start to get some of the symptoms that we talked about as a result of that. The blue light at night. So our phones, our computers, when we're using those late into the night, it doesn't allow our bodies to lower our cortisol and make our melatonin the way we're supposed to. And therefore, we have more problems with sleep. And this actually disrupts the circadian rhythm of how your cortisol is supposed to be highest in the morning, drop by half at noon, drop by half at 3, drop by half at midnight again. So it's lowest at the time you're supposed to be going to sleep, and your sleep can work better. And then, of course, we have indoor light deficiency. We have a lot of different types of light that are not natural light for us, and that can play with our vitamin D. It can also play with the circadian rhythm and the mitochondria as well. So we have all of these things kind of fighting against us instead of helping us. And these are the things that disrupt the mitochondria the most. So when we look at the hormones and the mitochondria connection, the other thing that we look at is thyroid. So thyroid hormones directly regulate your mitochondria. If your TSH is too high, that means opposite of what makes sense in our brain. So that means that the thyroid is more sluggish and the body wants more hormones. So the brain is telling the thyroid to make more hormone, and therefore it creates more TSH. And when we have a lower functioning thyroid, we have low fuel, low ATP. And many normal thyroid patients have what's called cellular hypothyroidism. Their numbers are just mildly off on their TSH, but they're not making enough T3, so their bodies can't fuel that fire the way it's supposed to. We talked a little bit about cortisol already, how it's supposed to be shifting in the circadian rhythm. But if you have chronic cortisol elevation, meaning your body's in constant stress, constant fight or flight, and the cortisol is staying high all the time, there's fragments of that mitochondria that suppress biogenesis, so the creation of new mitochondria. And then we develop something called adrenal fatigue, as often when the mitochondria get burnt out. And typically when that fatigue will come in is when you've burnt through all that cortisol, and now the cortisol is coming down. And now we're not producing enough of it in the time that we're supposed to. So when people have high cortisol levels, they tend to be racy and jittery, and they're tired. They're wired and tired. They're racy and jittery, but they're still tired. Once that cortisol flips over and you don't have enough of it anymore, you're just kind of flat. You're kind of dead. Like, you can't get out of bed. These are the people that sleep for 16, 18 hours and wake up and they still can't function. They still can't get up and move. They're just exhausted. And that's because the cortisol just being completely flatlined. Estrogen and progesterone are also a contributing factor. So estrogen supports the mitochondria and it creates antioxidant defenses. Progesterone is very neuroprotective. And when we have that hormonal decline in perimenopause, which happens about 7 to 10 years prior to menopause, average age being 52, give or take 2 years on either side. So you're really starting perimenopause in your late 30s, early 40s. This process accelerates the mitochondrial aging. So we will start to lose progesterone about age 35. We will maintain estrogen till about age 48-ish, and then we'll start to see estrogen decline. But that time frame that we didn't have enough progesterone compared to estrogen, we were in what was considered an estrogen dominant state, and that will create that mitochondrial issue for you. Testosterone. So testosterone regulates the mitochondria in muscle and brain and the regeneration of muscle and brain tissue. So low testosterone directly reduces cellular energy production in both men and women. So both men and women have testosterone. It's just the difference of how much. Just like men have estrogen and progesterone, they just have less of that than women have. Women have less testosterone than men have. But we can see a decline in all of these hormones across the board for both men and women. So if men have absolutely no estrogen in their body, that's not a great thing either, because then we will typically see erectile dysfunction and prostate enlargements. And there are some studies that show that it can increase a man's risk for prostate cancer if there's absolutely no estrogen present at all. Just like if there's not enough testosterone for women, we will see higher rates of breast cancer in those women that don't have a high enough testosterone level. So if you're somebody who has a higher testosterone level as a female, you might not like the irritability and the moodiness and the ability to just tell people where the bear shits in the woods sometimes without even worrying about it, because that's what testosterone does to us. But on the same token, your risk for breast cancer becomes a lot less. Versus if you have a lot of estrogen compared to progesterone, you're going to see a higher rate of breast inflammation and potentially breast cancer as well over time. So there's also the gut-brain mitochondrial axis. Oftentimes you'll hear people say gut-brain barrier, the gut-brain connection, and this is really what they're talking about. The gut health contributes exactly to the brain health. So when there's a lot of gut bacteria and we produce these short chain fatty acids that fuel the mitochondria, you get something called dysbiosis or endotoxins that creates mitochondrial disease and systemic inflammation. So the dysbiosis is just a big word for a bacterial imbalance. So you have more bad bacteria than you have good bacteria. And if there's endotoxins present, that means that the toxins like chemicals, metals, herbicides, pesticides, those kinds of things have started to create a toxic effect inside the gut that is now leading to mitochondrial damage and full systemic inflammation. And when we see some of these things occurring, we can see high cholesterol, fatty liver disease, you can see kidney disease, we can see brain health issues. So we will see a lot of these things start to occur before that disease process actually sets in. And oftentimes it takes 10, 15 years for that to happen if the person doesn't address any of these issues, because they're directly affecting the mitochondria. And then we have our brain health. So the brain uses roughly 20% of the total body energy, and those neurons have the highest mitochondrial density. So brain fog, anxiety, depression, these often begin with failing mitochondria. So when people talk about feeling like they have Alzheimer's, I feel like I have Alzheimer's. I'm forgetting things. I walk into a room. I don't know where I went to get something. I don't know what it was I went to get. I can't remember anything. I'm writing down notes everywhere, and then I forget where I put the note. I'm stumbling on my words. I can think of the word. I can see the word, but it can't come out of my mouth. These are the type of brain fog things that we are seeing when the mitochondria is disrupted. You can see anxiety occur as a disruption of the mitochondria. Sometimes it's the imbalance of the gut bacteria. Certain bacteria in the gut will create more anxiety and depression, just like certain good bacteria, if it's deficient, will increase the risk of anxiety and depression as well. And this often is what starts with the failing mitochondria. So you'll see these things go together. So if we can heal the mitochondria, we can heal the gut, then the brain can heal as well. But this is a cascade and it has to go through a process. The downside to this is time. It takes a minimum of the gut to turn over new cells, minimum 6 months for that to happen. So it's not like we can give you an antibiotic, we can get rid of the bacteria, and 10 days later, the gut's going to be better. No, it takes time for that gut lining to repair, and it is minimum 6 months for that to happen. So I'm curious for you guys, how many of these things apply to each of you? Is there fatigue that doesn't improve with rest? Is there brain fog or memory difficulties? Are there hormonal imbalances and irregular cycles, irregular menstrual cycles that shouldn't be there? Do we have gut issues, bloating, IBS, constipation, diarrhea, back and forth, gut upset, nausea, vomiting, diarrhea, pain, gastritis, those kinds of things? Or are you dealing more with maybe mood instability, anxiety, or depression? Or is there a history of infections like mold or toxic exposure that you've had that you haven't been able to clear out yet? Because all of these kinds of things are going to contribute to that mitochondrial damage. So think about those things. You can take some mental notes like, yes, I have this. No, I don't have that. Or maybe you have everything. And you can share that with us when we start to do the Q&A process as well here. So why do you feel older than you are? Well, this is typically what we're seeing when NAD plus, this is an amino acid, when that becomes declining in the body, NAD actually fuels the sirtuins, which are your longevity genes, and it powers DNA repair. And it's essential for what we call electron transport chains, so that the transport of the cells. Typically, NAD declines by 50% by age 50. So we only have half of what we did when we were 20. And it's linked to virtually every age-related disease that there is. So NAD is arguably one of the most important molecules in the body for healthy aging, and it's difficult to get in the body. So it's not well absorbed through the gut. It has to be given either by IV or nasal spray. IV is a slow drip over like a 3 to 5 hour period of time. But now we have the ability to use NAD plus as a nasal spray, and you can use it on a daily basis. And it works great with anxiety, really great for depression and that cognitive function. We see a lot of repair with the NAD there. So I always like to tell people it's important to test, not guess. We need to find out what's actually happening with your cells. So sometimes we'll do an organic acid test. We'll do mitochondrial function test. We can do NAD and micronutrient testing. We can do heavy metals and chemical testing for you. And all of these things help us put together a picture. We can also do specific gut testing. I'm not a huge oat fan. I like individual gut testing instead. Even with its limitations, I still like that a little bit better than oat testing. We can do supportive things like refueling the cellular energy in the body. So we can do niacinamide, which is B3. This is an NAD precursor. It's affordable. It's very accessible. We can do nicotinic acid. So for people that are thinking about doing nicotine patches and you don't want the actual nicotine from there, you can use nicotinic acid and it can do the same types of things. You definitely want to do the flush form. It activates the sirtuin pathway, so that's really important for you to do that. You want a diet that's rich in tryptophan. So dietary NAD precursors, like via the kynurin pathway, come from tryptophan-rich foods, turkey, things like that, nuts and seeds, almonds. They have a lot of tryptophan in them. And then if you want to look at doing something a little bit more advanced, you would add something called NMN. And this product is really great, but it's very difficult to find a high enough quality product to really give you the benefit that you're looking for. It is a direct precursor to NAD. However, it has to be given in either a sublingual fashion, or there are very specific supplementations made by Dr. David Sinclair for NMN to actually be absorbable. You can also do something called NR, nicotinamide riboside. This is very well researched, and the True Niagen protocol is really good. And then resveratrol plus NMN can work really well too, because this also activates the sirtuins to elongate that telomere length. And then clinically, we can do IV NAD, like we talked about. It's most rapidly available. It bypasses the gut. So if you have a gut absorption issue, doing IV is really helpful. Oftentimes, you don't need to do it long term. You can do a short course of them. We talked a little bit about NAD nasal spray. It goes directly across the blood-brain barrier, which is great for mitochondrial support and that cognitive dysfunction. And then sometimes we will use these things in high dose protocols, especially in addiction recovery or neurological repair. So if someone has Parkinson's, MS, ALS, Alzheimer's, dementia, these types of things will be used in very high doses because we have a short period of time to cause that reversal and prevent that damage from taking seed in those things. So there's also what we call redox therapies that you can do, and this rebalances your cellular chemistry. So we can do ozone, which is oxygen therapy. Ozone actually stimulates the antioxidant enzymes like SOD and GPX and upregulates the NRF2 pathway. And it trains your mitochondria to adapt to oxidative challenges. And then we have methylene blue, which is very well known for mitochondria support. This is also a redox molecule that can donate and accept electrons, acting as an alternative electron transport carrier, and can support cognitive function, but really great at the mitochondrial resilience. You can do this by IV or oral capsules. I will warn you, the oral capsules, or if you do a liquid over the counter, it is going to stain your toilet bowl. So be prepared for that. It is this bright, vibrant blue, much like what we're seeing on the screen, and it can stain things. So just be cautious with it. And then, of course, there's glutathione, either IV or liposomal in nature. And glutathione is the master antioxidant. It protects the mitochondrial membrane from oxidative damage, and depletion is nearly universal in chronic illness. Very important, especially if you've been exposed to heavy metals or chemicals, to help get those things out of the body. And then we have red light, either near or infrared light. This is really great because it stimulates the cytochrome C oxidase complex. It directly enhances that ATP, that fuel production, and extremely well studied at Harvard by Dr. Michael Hamblin. So red light therapy can be very, very helpful for people. So this is what we look at and why. So we're looking at all of these things that create mitochondrial damage. So we look at the mitochondrial metabolites, so citrate, succinate, fumarate, malate, the Krebs cycle intermediaries, and this shows us where the energy cycle is stalling. We look at nutrient status, so CoQ10, glutathione, the B vitamins, carnitine, magnesium, and zinc. We do this through something called cell science. And this is what your mitochondria are actually starving for. And we can see what's available on a cellular level versus what's in the bloodstream and maybe bound to a protein. We look for oxidative stress, DNA damage, lipid peroxidase, and these things can actually measure your mitochondrial damage. And then we look at hormones, so full thyroid, cortisol, sex hormones, and your hormonal load on your mitochondria. And then we also look at the toxin and infection burden as well. So we want to see mycotoxins, heavy metals, Lyme, Epstein-Barr, chemicals, all of these kinds of things. What are attacking you from the outside in, damaging that mitochondria? So that's why we look at a lot of these things. It isn't just to look to see if you're deficient or look to see if you've got an infection. It's to see what kind of protocol we can put you on before things. So I want to share a protocol with you, or share a case study with you guys. So there was a patient of ours, her name is Sarah, and she felt like she was aging at double the speed. And before, she had crushing fatigue. She was in bed by 7. She had 25 pounds of unexplained weight gain. She had brain fog, couldn't recall her words, anxiety, mood instability, 3 rounds of antidepressants with no relief. And then she was told all of her labs were normal. And then afterwards, her energy came back in about 2 months. She released 18 pounds without dieting over a 6-month period of time. She had mental clarity restored, mood stable, and anxiety resolved. She was off all of her medications and felt better than she had in 10 years. So what we did with her was OAT testing to look for depletion and oxidative stress markers. We gave her IV NAD times 6 rounds of IVs, and then mitochondrial nutrient support and hormone support. And this is how we were able to turn her around. Not everybody responds this quickly or this easily. And everybody's approach can look a little different. It's personalized to you based simply on what we see on your test results. So not everybody's going to get the exact same protocol here. What's one thing that landed for you today? Does your body feel broken? It isn't. It's just disrupted a little bit. It's been speaking to you all along, but if you don't listen to it, it's going to speak louder and louder and louder. And the louder it speaks, the more symptoms you're going to have, the harder it is going to be to turn things around. But you have to learn to listen to your body. It's telling you those things every single day, those little messages. Now, here's 5 things that you can do right now to help your body repair. So Protect your sleep as best you can. That is sacred. This is where your mitochondria repair. So we want to shoot for 7 to 8 hours of sleep, reduce the blue light after sunset. So if you have to do computer work, there is a blue light blocker setting on your computer that you can set to make it so you don't have that blue light in your eyes, even though you have to work a little bit later. You want to keep your room a little bit cooler, between like 65 and 67 degrees. The mitochondria repair, and that happens during sleep. And it's better when your sleep is cool versus warm. You want to eliminate the biggest mitochondrial toxins first. So reduce the ultra processed foods, reduce your alcohol, definitely white refined sugar. Filter your water because chlorine disrupts the mitochondrial function, and reduce your plastic storage and plastic consumption. So if you're drinking water in plastic, get rid of that. Use a filter. If you're drinking off of a well, get your well tested to make sure there's none of these contaminants in the well. That's really important. Add your mitochondrial foundational nutrients like your CoQ10, magnesium, B complex. These are all the raw materials your electron transport chain needs every single day. And then start to move smarter, not just harder. Do short, intense movements, 10 to 20 minutes. This triggers the mitochondria to repair. And then you can do zone 2 cardio, like 30 to 45 minutes. This builds mitochondrial density, and avoid chronic overtraining. So don't spend 5 hours at the gym. Make sure you're training and you have a rest and repair day. If you like to lift weights, arms one day, legs the next. Don't always work out the same body part every single day. That's too stressful on your body. It doesn't have time to repair. Get tested, know what your mitochondrial baseline is. We're also using peptides these days that can be helpful. Things like MOTS-c, BPC 157. These things can help repair your mitochondria. There are things that can help support the immune system, like the thymus peptides. A lot of these things can be helpful these days to speed that process up for you as well. So if you're ready to find out what your cells are saying, we do have a mitochondrial quiz on our website. If you have an appointment with your primary doc that's coming up in Serenity, you can certainly reach out to them, talk about mitochondria. If you are not yet a patient here at Serenity, you can book a consultation and you can ask about IV and AD therapy. If you've never done that before and you feel like that's something that might benefit you, talk to your practitioner about that, or even peptides as well. Are you a candidate for some of those things? Are you a candidate for ozone? Because these things can help you repair a lot quicker. So thank you for listening to this tonight. I want you to remember your energy and your vitality and your healing are not behind you. They're just waiting for you. You just need to take charge and be patient and continue to work hard with your practitioner to find the answers of what's destroying the mitochondria.